Good morning, everybody. So I want to chat a little bit about the cycles from the different pests because it's important to understand what their life cycles are in order to then also know how to go about treating and preventing. So let me just start with heartworm because that's a big subject as well. And what I find in my practice is that sometimes people aren't quite aware what heartworm is and how the cycle goes and all of that, and it's really important for everything that we know. Heartworm cycle requires two hosts. One is the mosquito and one is the dog or the cat. And the way it works is that we have the adult heartworm in the heart of the dog, and these adult heartworms, they mate and they make microfilaria. Those are the little babies they make. And these little microfilaria, they float around in the blood. And when a mosquito starts sucking on the animal, it will pick up these microfilaria and will continue to develop the microfilaria into the infective larvae, which is the larvae 3, the stage 3. And that takes about 14 days or longer, depending on what the weather is like, how warm it is outside, etc. So once these larvae have become the infective larvae and the mosquito bites another dog, then these larvae will be transmitted into the dog where they go through a tissue phase. So they kind of wander around the tissue for a few days and they continue to evolve until they become adults and end up in the heart. So it takes about 14 days or longer for the mosquitoes to have the infective larvae, and it takes about 3 to 4 months post-infection in the dog for the adult heartworms to show up, and it takes another couple of months or so for them to actually start to produce offspring. So basically what that means is that it takes about 6 to 7 months until we have microfilaria being produced, more babies being produced. I hope that makes sense. And so when the microfilaria float around in the blood, we can test for those, and we can also test for the adults. So usually when you go to your vet for a heartworm test, what they test is for the adult heartworm. So not for the larvae that come in and wander around, but for the adults. So that means that when you have a puppy, there's no point doing any heartworm tests because there won't be any antigen there. So the test that is done is for the adults. And then we also have a test for microfilaria, which tests for the babies. So we can do both of those. But again, it takes about 6 to 7 months for the test to be showing heartworm. And if they're only male heartworm, then we get a negative test. So tests are not 100% either. That's why I like to do it on a regular basis, at least every 6 months, because that way we get a little bit more information of, what might be going on in between. So that was for the life cycle of heartworm. And there are some conditions that are necessary for transmission, for example, the right climate. So the temperature has to be above 57 degrees consistently for any development of the larvae in the mosquito to even be happening. And if it goes below 57 degrees, there's no development happening. It just basically stunts that. The mosquito also, and that's very logic, but the mosquito has to have sucked blood from an infected dog about 2 weeks before in order to be able to infect your animal. So in our neighborhood in the Chicago, Illinois area and other northern parts, the prevalence of heartworm disease is very low. So even if you have a lot of mosquitoes in your neighborhood, unless they actually have infective larvae, there's no way that they can infect your dog. The mosquito also has to be a female because the females are the ones that suck the blood. So if you don't have any female mosquitoes around, then nothing is going to happen. There are also different mosquito species that allow the development of worms. There are about 70 different species, but not all of them allow the development of heartworm in them. Once the mosquito actually bites the dog, it leaves a little droplet next to the injection site. And that's where the larvae are. So if the climate is really dry, this little droplet may dry out and the larvae may die even before it starts to get into the dog. And then last but not least, there also needs to be a weakened immune system. because if you have a really, really healthy dog, then the immune system will also take care of much of that by itself. So temperatures 57 degrees, and even then it may not come to an infective larva, because it takes about a month for them to develop into infective larvae at 64 degrees Fahrenheit. And a lot of mosquitoes only live about 3 to 4 weeks, so that means that the infection may not happen because the mosquito may die before it even gets back to infecting another dog. Yeah, heartworm medications don't prevent, they just kill. Yeah, they're not really a preventative, because they go in, they kill something, and then they leave. The heartworm medication only stays in the system for about 72 hours. So it's a little bit of a misnomer to call it a preventative. And the heartworm medication does work backwards. That's very true. The dog gets infected with the larvae, and the larvae float around, and then we give the heartworm preventative, and all the larvae that got in are killed in that process. But then once the heartworm medication is out of the system, more larvae can come in, and then they're going to get killed again by the next round of heartworm preventative that is given. Yes, a lot of these heartworm preventatives, they actually can cause seizures. So with a dog that already has seizures, you have to be very careful. I usually don't recommend heartworm preventative for these dogs. I usually recommend more of an herbal preventative. That might be a better idea for them, so that their nervous system doesn't get triggered excessively, and the seizures don't get worse. Especially some of the newer drugs, moxidectin, not that it's that new, but it's being used in some of these heartworm preventatives, such as ProHeart. ProHeart is an injectable, and it was removed from the market because it was causing deaths, and it was unfortunately reintroduced. And recently they actually created a ProHeart 12, which is a preventative for 12 months total. ProHeart 6 was for 6 months, so it stays in the system for that long. And it was already killing the ones on ProHeart 6, the dogs, and now they're increasing it to a 12 months injectable, which makes absolutely no sense to have something that would kill dogs even more, because what happens is they actually increase the moxidectin, which is the active ingredient, to 3 times what it was in ProHeart 6. So definitely I would highly warn you not to use that one. Lots of side effects, including neurologic signs, especially lots of vomiting, diarrhea, injection site issues, agitation, hiding, pacing, scratching. I have a whole list here. Anaphylaxis, elevated liver enzyme, immune-mediated blood problems, cardiovascular disease, tumors, including mast cell, lymphosarcoma, histiocytoma. So definitely not something that you would ever want to use on your dog. There are other ones that are much safer if you are living in an area that's a little bit more endemic, where you have a lot more heartworm. You may have to go more with a drug, but definitely stay away from the ProHeart of the world, because the problem is that with all of these preventatives, once they're in the system, there's absolutely no way of getting them back out. So you basically have to sort of wait it out. And a lot of times they've also not done sufficient studies to see how long they actually stay in the system. I just heard a story the other day of someone who used Bravecto, which is a flea and tick preventative. And even a year later, after the one-time dose of Bravecto, the ticks were still dying on the dog. We don't really know what all of these things are doing, but once they're in the system, we can't take them back out. So when we talk about heartworm preventatives, probably the safest one would be Interceptor, which is a milbemycin. There are also different dosages that had been published in the past, are not so much used here in the States, but more so in Europe. And it's called the Safe Heart Protocol, which actually uses a much smaller dose that just kills the heartworm. Safe Heart dose is 1/5 of the Interceptor dosage, but that only works for heartworm. So it wouldn't kill any of the other intestinal parasites. At a higher dose, it will also kill intestinal parasites. And that brings me to another point. When it comes to some of these heartworm preventatives, I would definitely stay away from all the pluses or the maxes or any of the ones that do multiple things at the same time, because for one, an animal does not need to be dewormed for intestinal parasites every month. I prefer to do fecal testing just to see if they actually have parasites. For the other multis, for example, like Revolution and some of those, they have both tick and flea preventative as well as heartworm, and it's always best if you do go with chemicals to spread them apart so that you don't give both at the same time the same day. And always do some detox afterwards. That is very important. I usually recommend at least doing a little bit of milk thistle for 7 days after any sort of heartworm or any sort of preventative that's chemical. Since we are on the chemicals, on the chemical preventatives, I just briefly want to mention some of the newer ones that came out for fleas and ticks, including Bravecto, NexGard, Simparica, Credelio. They all contain isoxazolines, which are very, very toxic to the body. Since they came out until July of 2018, they had over 50,000 reported complaints about adverse reactions. But since we all know that most people don't really report any sort of adverse reactions, that's only a very small percentage. So I think it was about 1%. That's kind of the estimate. So if you kind of multiply that by 100, then you have a lot of animals that have had adverse reactions to some of these drugs. So NexGard, Bravecto Plus for cats, Simparica, and then Simparica Trio is probably even more dangerous because not only does it contain what's in ProHeart, it also contains the isoxazoline and on top of that pyranthal. So I would highly recommend staying away from any of these drugs that do everything for the animal. So stay with the ones that are safer, the ones that get into the system and are out. That's much better. So if you have a lot of fleas and ticks in your neighborhood and you have to do something about flea and tick prevention chemically because it's so bad, or you yourself have a lot of reactions. I have one client, she does everything holistic except for that, just because she gets major reactions from fleas and tick bites and has autoimmune issues herself. So she just has to do it in order to protect herself. Better choices are, Interceptor, as I mentioned, for heartworm. And then for fleas and ticks, topicals would be better, such as Frontline, for example. Because the thing is, too, if you're actually giving a flea and tick preventative orally, the fleas and the ticks still have to suck on the dog or attach in order to get killed. And for killing ticks, it can take up to 48 hours, and that's plenty of time for Lyme disease and other tick-borne microbes to get into your dog. So it's really not a very, very good idea, preventatively wise. And especially in a dog that has flea allergies, if a flea has to suck to get killed, it's also not all that helpful because the allergies will continue to be perpetuated. So with fleas, we can have regular itching just because fleas are there and are stinging, kind of like we get a mosquito bite. But some dogs, they have flea sensitivity to the saliva of the flea, and they just become crazy itchy, even if it's just one flea that kind of attached and sucked on them. HWF stands for Heartworm Free. It's a herbal remedy that can be used as a heartworm preventative and also to treat heartworm. I have had 2 patients that were heartworm positive because they came from the south, which is most of the dogs that we see here with heartworm. But heartworm free HWF from Amber Technology is something that I do recommend in my practice as one of the preventatives. The only caveat is that there have not been any studies done on the efficacy of it. It's all more word of mouth, anecdotal evidence. But as I said, I had 2 dogs that were heartworm positive, and they did the HWF protocol to get rid of, or the Amber Technology protocol, I should say, and they both turned heartworm negative.
It's a slow kill method, so that means they don't have to be restricted exercise-wise.
Traditional heartworm treatment if a dog is heartworm positive, they have to be on restricted exercise because as the parasites are being killed within the system, in the heart, some of these parts of the heartworm can get lodged into the lungs and cause emboli, which can be very life-threatening. So they cannot exercise for quite some time until the whole issue is resolved. So with the heart HWF from Amber Technology, they don't have to because it's a slow kill method. I also recommend it as a preventative in my area, but I also tell people to do a heartworm test at least every 6 months if they do use it, just because there's no studies, and well, I just want to make sure that my patients don't end up with heartworm, and I'd rather test earlier. Yes, giving a heartworm preventative every 45 days, that works. And then using liver detox, perfect. Milk thistle or SAMe, all very good. Garlic is definitely something to prevent fleas and ticks because there's some scent that comes out from garlic. Best though is to use fresh garlic because the fresh garlic that's all chopped up will have the allicin in it, which also has a lot of good medical properties. So putting a little bit of garlic with your dog's food is great. And I know there's always the question about toxicity of garlic, but in the study they found that they really had to use a huge amount of garlic to even cause any issues. So if you have a Chihuahua, you would have to give it a whole bulb of garlic, which no Chihuahua or no dog is going to eat that much garlic. I doubt it anyways. So garlic guidelines, a half a clove of garlic per 10 pound of body weight. That would kind of be appropriate, and I would not go over 2 cloves of garlic no matter what the size is. There are different things that you can use topically. A lot of shampoos, for example, Kin and Kind, they have a shampoo that will also allow to kill fleas. Using a flea comb is very important if you do have fleas, and even if you don't have fleas during flea season, if you can flea comb your dog before you even get into the house after a walk, that probably would be a good idea, because that way you don't spread a lot of fleas into your house, because fleas, they do tend to multiply very quickly, and then they drop the eggs, and then the eggs turn into larvae, and the larvae then turn into fleas. So there's a lot of multiplication going on. So the more you can prevent that from coming into your house, the better. And then there's all sorts of things that you can also do as far as, before you go out on a trail, for example, on a hike, you can spray them with a little bit of something that has apple cider vinegar in it, essential oils, just to kind of repel the fleas. There are different recipes, and I found some good ones from Dr. Becker. Obviously, she's always very resourceful. So she has a couple of recipes. It basically has lemon juice, water, and then some vanilla extract that apparently is also a bit of a deterrent, and catnip oil. Catnip oil is actually quite effective. It's very similar to DEET, which is a chemical that is a deterrent for fleas and ticks. So it's as effective as that, and it's also good for mosquitoes. Lemon, lemongrass, eucalyptus, geranium, essential oils, all of these things are good as well. If you have a short-haired dog, you can also add a little bit of coconut oil to their coat before you go out, because the fleas and ticks don't really like the coconut oil. They just kind of fall off. Obviously not too much, otherwise you're going to have a greasy sofa. It may not work as well for dogs with long hair. So lots of sprays. I also use Veterinary Repel, which is a spray that's already pre-made, but you can definitely make your own spray. That's very easy to do. Then for ticks, a really good thing, when you come home from a hike, just take a lint roller and roll it over their coat. And that way you'll catch a lot of the ticks that are still kind of wandering around, but that haven't gone into the deeper crevices, especially in the long-haired dogs. And then checking is very, very important. You could also put a shirt on your dog. That would also help to prevent the amount of ticks that may get on them. Internally, there was a study that was done in Germany with cistus tea, which is rock rose. That grows kind of more in the Mediterranean areas, and it has all sorts of really great effects. Antiviral, prevents HIV, for example, to infect cells. It also kills Borrelia, which is the bacteria that causes Lyme disease. It's an antioxidant and does all sorts of good things. And they did a study in Germany And it wasn't a study that was published. It was a holistic vet who was just doing some trials, and they did that with 48 dogs. And 32 of these dogs, they were getting some cystus tea every day for 20 days. 10 of the 48 dogs, they received frontline, and then there were 6 control animals that did not get anything. And what they found is that the ones that were getting the cystus tea, they actually had 0 to 2 ticks. The ones with frontline, they obviously had less ticks as well, but they still had some as well. And the control animals, they had an average of 150 ticks in that 20-day period. So you can see 0 to 2 ticks with cystus, and doing nothing, 150 ticks. So that's pretty good. So cystus tea can be purchased online. There are different companies, including BioPure, that sells it. It takes about 5 days to take effect. So you want to give it for 5 days, and then you should start seeing a difference. I actually just talked to one of my clients yesterday who uses cystus tea for his dog because he lives on a farm and there's tons of ticks. There's some wooded areas as well. And he said that he definitely saw a significant decrease in ticks in his dog. There are also collars that you can use, the amber stone collars that are made from raw amber stones that are basically petrified resin. And you just put them on around their necks, and they're quite pretty. You can get your own design. One of my dogs, he has little skulls included to make it nice and masculine. Anyways, they're quite pretty to look at. And the way they work is that the collar continuously rubs against the coat and creates a little bit of an electromagnetic field that then makes the animal look a little bit more like a walking bush, for example. And that's very confusing to the ticks because, they don't really want to suck on a bush, right? The amber collars, because it's petrified resin, they also will release a little bit of a scent with the temperature from the body. And that too is a repellent for ticks. They don't really, they get confused. Because the thing is with a lot of these things that we put on them, it's just more that we try to create a little bit of confusion so that they don't quite know what it is that's actually coming along as you were walking. Not a huge fan of Seresto collars because they can also cause some toxicity, so not a huge fan of those. There are other collars that you can use. There's also Alzu. Alzu has a spot on. It has geraniol oil in it, which is one of the most potent ones on the natural side. It stays on there for 30 days unless you wash your dog or your dog goes swimming a lot. And they also have the collar. But generally for fleas and ticks, it's always best to use multiple approaches, from different angles. Because I find that none of them really all work just by themselves. And it also depends on how infested your area is. If you're in an area that has a lot of fleas, you definitely want to make sure you also treat the environment. And you can treat the environment by putting out nematodes that will eat the larvae of the different insects, including mosquitoes. There's also things that you can spray in your house. For example, diatomaceous earth can be used. You can just sprinkle it in the areas where your dog lays around because diatomaceous earth will dry out some of these insects and kill them that way. Sodium polyborate that can be used. You can spray that on your carpets, for example, and they will stay in the carpet even when you vacuum. The only time it would come off is when you steam clean. Diatomaceous earth, definitely you want to make sure that it's food grade. Just doing a lot of vacuuming is very important, especially during the times where they're more prevalent. Fleas and ticks, we see those a lot in the spring and the fall. Here in the Chicago area, it was really bad last fall. All of a sudden, we had multiple dogs come in every day with itching and fleas. So we ended up with no rooms to put anybody in because all of them had been occupied by a dog with fleas that we had to, clean first. So that was fun. Outdoors, we also have tick tubes. They are biodegradable. You can put them out and that will help to kind of decrease the amount of ticks that you have. There's also something called mosquito barrier, which is a garlic that you can spray in your yard that will also deter some of these critters. Plants that are deer resistant are also helpful. That way you get less deer coming to your yard and dropping off ticks. Plants such as lavender, sage, mint, wormwood, rosemary, marigolds, etc. are also plants that you can plant that because ticks and fleas don't like them very much. And then also keeping your grass short can help because a lot of these little critters, they kind of like to hide in the moist and darker areas. So that should help a lot. I think it's always helpful to also test for tick-borne diseases when you do heartworm testing. It's only a few dollars more, but it's so easy to do if you're doing blood work anyway. So I highly recommend checking that on a regular basis as well, just to make sure that your animals don't have anything. Although tick-borne diseases, Lyme and such, they are very good at evading the immune system. So just because the test result comes back as negative doesn't mean they don't have it. And just because the test is positive also doesn't mean that they have it. They may just have been exposed. So testing certainly can help just to kind of, give us a bit of an idea of whether they have had some exposure in the past or not, but it's certainly not giving you all the information you need. And all these tick-borne diseases, they can cause all sorts of symptoms. Lyme disease is kind of called the great imitator. It can cause all sorts of diseases, not just joint issues, but also neurologic issues, including Parkinson's for humans and all sorts of things, kidney issues. I know Lyme disease is very scary. There's a lot of fear around that out there. But if it's caught early, it can be treated. The key to treating for Lyme disease is to work with how the microbe actually evades the immune system. So what I usually do is I check if there's something going on. I usually use muscle testing for that. And then if there's something going on, I will find which herb will work. And then I recheck them with muscle testing 2 to 3 weeks later, because that's usually about the time it takes for these microbes to kind of find a new strategy to evade whatever I'm giving them right now, or what I'm trying to kill them with right now. And so then I switch to something else. And then I recheck in 2 to 3 weeks. And I keep going with that, and I switch the remedies, and I use a lot of herbs. I actually rarely use antibiotics because there are a lot of herbs that are really very potent and very good at that. And so I switch that every couple 2 to 3 weeks. I switch to a different remedy, and then we switch and switch until I can't detect it anymore with muscle testing for a couple of times. And that can take a few months. But usually, it's very effective and the animals feel better. I do have one patient right now. She had some issues with the nervous system, with inflammation in the spinal cord. And so every 2 to 3 weeks, we've changed remedies, and she's continued to improve. And she's almost off the steroids that help for, to keep the inflammation down, because inflammation in the nervous system can be quite damaging to the animal and quite uncomfortable and cause neurologic signs. So anyways, it's been quite nice to see and interesting learning experience as well, because with every animal that I see, it's always a little bit different and something new to learn. So tick-borne diseases can definitely be treated. If your dog never has had a tick, doesn't mean they can't have the tick-borne diseases, because they can be transmitted by other insects. One of the best preventatives on the market, so to speak, is to really make sure that your animals are healthy. So feeding them a species-appropriate diet is very important. Making sure their gut is healthy, because the gut, that's where all the microbes are that basically make the body work, including the immune system. So if you have a microbiome imbalance in the gut, then the immune system is not going to be as able to fight all these different diseases that an animal can be exposed to. So those are very, very important. And then I also highly recommend doing detox. Detox is very important. I do recommend doing that twice a year, because we do live in a very polluted environment, and the bodies, all of our bodies need some regular detoxification to just clean out the gunk. So that the immune system can work better. Because if the immune system is all focused on cleaning out toxins, because anytime you have toxins, it creates inflammation, and inflammation is basically the immune system being activated. So if the immune system is busy doing other things, it will not be as able to fight other things. I prefer to have things separate, so that you're not using flea and tick preventatives and heartworm preventatives in the same week. So I'm not a huge fan of chemicals, period. Sometimes they are needed, but if you do use chemicals, I recommend just doing it more, like split, not, everything all at the same time. The healthier an animal is, the less attractive they are to fleas and ticks and heartworm and mosquitoes in general, because the sicker an animal is, the more CO2 they give up, and that's more attractive to these insects. You probably have seen that maybe in your own household where one of the animals has a lot of fleas and the other one doesn't have any, or with mosquitoes. I always like to go outside at night with someone who's a mosquito magnet, because they don't like me very much, but if I'm all by myself, then they go after me too. But I think making sure that the animal is as healthy as possible will also help to deter them from being chewed up and infested. Don't forget to check the dog's ears for ticks. Yes, and they can also get into the mouth between the gums. And yes, tick removal. Make sure you use one of these tick tools to grab the tick by the head where it's attached to the body, and not to squeeze the tick, because when you squeeze the tick, you can actually create more injecting of saliva, which is where all these microbes would be. So it's best to kind of remove it and with one of these little tick tools. Yeah, diatomaceous earth can definitely be used. You just have to be careful, because first of all, it has to be food grade, as I mentioned earlier. And then you want to make sure that when you spray it around, there's not too much of it, because when inhaled, it's not really all that helpful for the lungs. So you have to be a little bit careful on that, but it definitely will kill things. I'm not a huge fan of diatomaceous earth internally, because diatomaceous earth only works on parasites that have a hard shell, basically. So it doesn't really work for the soft parasites that would be internally. So lead them 3 times a day for 3 days. Can be given after tick infestation, especially if there are symptoms, and it doesn't matter if the symptoms are present now or if it was, back then. So it doesn't matter how chronic it is, I guess, is what I'm trying to say. There are also some that use it as a preventative every 4 to 8 weeks to decrease tick infestation, so certainly something that can be done. Some veterinarians will also use a nosode, for a Borrelia nosode, that can be given every day for a week, and then once a week for a month, and then every 6 months. I do use nosodes as well. I have one that I use more for actual treatment afterwards, and it doesn't have just Lyme in it. It also has Bartonella, Rickettsia, chlamydia, and all of the other microbes that can be transmitted through insects. But for my patients, what I usually do when they had a tick bite, I usually tell people to keep the tick, because you can also send it into a lab to see what kind of microbes were in that tick. So that can be very helpful. I just had a client do that the other day, and it came back as just having Borrelia in it, so none of the other ones. And so we're going to work on just helping the body deal with that. Thanks so much for joining, and feel free to share and listen again. I know there was a lot of information